outcome variable before you start. So the heat the heat map over here is more like an exploratory data analysis with values between 0, -1, and then +1. Then we also have the rock cave, and then the model is highly effective in distinguishing between diabetic and non-diabetic. If your rock cave value is closer to 1, that means it's highly effective. But if it is far away from 1, it is least effective. Now, implementing solutions in low resource settings. We find ourselves in Africa, which we all agree is a low resource setting. So that means there'll be challenges when they come analysis. So here we have to tend to use maybe lightweight models. We try to run our algorithms on laptops, mobile devices, rather than using heavyweight models. Then also use open data and then open sources. Open data we can get from VIMs. Then for the open sources, Python is there, R is there, you can use them. This reduces the cost of computational support. Then also have capacity building and local training, just like Synthesini is doing. We train people on data analysis and then how to analyze and then stuff. And then simple visual workflows. You don't try to do complex analysis. Do something that is simple but then insightful. If it is simple and insightful, you are good to go. Now, this is the emerging trend. Whether we like it or not, AI is the future, and it has already proven that it is of benefit to the medical field or the health field. And in the future, this is what we are going to be seeing: the future of AI in healthcare, helping with treatments, diagnostics, ethics, and then challenges in software development as well. So these are the takeaways, which I believed we've all learned and appreciated. Statistical modeling plus Python, when you combine both, you get powerful insights. Also learn that ML transforms health data into actionable knowledge. Then we also have adaptation to local resource is key. There's DIMS and then R, we can all use all those. Then we use simple icons or check marks. Visualization, use simple charts and then icons for your visualization and then other insights. Yeah, so in questions and answers, and then yeah, thank you.
Yeah, thank you very much, Mr. Abdul, for that massive presentation. So, if you're just joining, before we started, Mr. Abdul is an emerging epidemiologist and biostatistician with strong expertise in infectious disease, statistical machine learning, applied public health research. Okay, so he's currently an ambassador for Centesini. He's one of our regional ambassadors for Centesini team in Ghana, where we are advancing AI-powered evidence-based research and capacity building across Africa. So I want to say a very big thank you to you for that particular presentation. So participants, if you've got any question for him with respect to this, you can just drop it on the chat. For now, we'll be preparing our next speaker. Because of time, we don't have so much time by our side. I want to make sure we keep everything snappy and also have a short practical section from one of our facilitators. So if you've got questions, please drop it on the chat box. The slide resource materials is going to be sent via email to participants that did register for this particular event. So thank you so much once again, Mr. Yeah, so I think there are some questions that are being asked, but we are going to go over those questions in after the very next one. So I want to actually highlight something to our participants. I want to say something. Cindra combines data analysis and slash analytics. It combines that with evidence-based research and AI. So this is more like a three-horse in innovation that we are bringing together. Okay, so every time we have our event, Cindra, we bring in data analysis experts, AI experts, and research expert, people who are very solidly good in research. So I want to, the reason why I'm making mention of this is that the next speaker we're going to be having now, she's going to talk about some things around collaboration in research. Okay. Then after that, we're going to have a very insightful practical session from Mr. Chijioke, who is also an expert in data analysis. So What we've just received right now is somebody that is very seasoned from biostatistics, epidemiology, machine learning, and AI. So now we're going to have a touch from one of our very reputable doctors, somebody who has accomplished a lot of things in the field of research, won numerous grants, and she's currently leading a very substantial research team. So I'm going to welcome Dr. Sobani Sophia. She is the founder of Sobani Resources. Ladies and gentlemen, I'm going to let you know that I didn't just start Sentencing. Sentencing is one that was born out of Sobani. I was once a full systematic reviewer at Sobani Resources, and and I continue to be a member of Sobani Resources. So Sophia is an accomplished leader with a PhD in environmental toxicology. She has over 6 years of experience in the academic and organizational management. She has, including significant roles within international NGOs. She has a very, very substantial experience when it comes to working with non-governmental organizations. Now, as the founder of Sobani Resources, which is an outstanding team out there for research. Her expertise spans across sexual and reproductive health, HIV and AIDS program implementation, women's endocrine health advocacy. So when I talk about this women's health advocacy, Dr. Sophia is one that is at the very core. She leads a lot of organizations. She's a team leader. And I want to also let you know that aside from Sobani Resources, which she is the founder of, she's also the founder of Endocrine Health Foundation. She has led several campaigns, you know, and support programs impacting over 300 plus women living with PCOS. I'm sure we know, the problem that comes with that condition and other endocrine conditions. She also brings hands-on experience with working with female sex workers in HIV, sexual reproductive health interventions through the University of Maryland, Baltimore. And she has contributed to USAID, FHI 360, SIDHES project on HIV and AIDS program monitoring and evaluation. So, ladies and gentlemen, she has a very strong background in leadership, which I can attest to. Strategic planning. She's somebody that is well organized, and public health research. She's exceptionally well suited for leadership roles in global health and medical technological organizations. So she's going to be giving us insights right now on how collaboration technology works, how to collaborate in research, and she's going to be leading us with she's going to be sharing some of her nuggets. I'm sure she has a lot, impact for us and for participants, because as much as we talk about data analysis, how to practice, how to do proper research, how to leverage AI technologies, we cannot overlook the need for collaboration. So she's going to grind us in that aspect. And yeah, she's somebody that I've worked with, and she's somebody that has all the reputation. She knows what it means to manage a team. And basically, I continue to learn from her. So, ladies and gentlemen, please just drop some emoji. So just drop some emoji to our doctor. You can see her there. So, doctor, over to you, ma. Thank you for all you do.
Okay,
Okay, you can share your slides.
so I'm trying to share my screen. Yes, please. So give me some time. Sorry, give me some time to quickly share this. Okay. Yes, can you see my screen? Can you see my screen now? Okay. So can we see my screen? Okay. So sorry, Dr. David. Or did I go off?
Okay, thank you, thank you. We can see your
Dr.
screen, but
David.
your slide.
Yes. Oh, you could see my screen.
Yeah,
Okay,
but the
okay.
slide, we've not seen the
Because
slide.
that's what I wanted. You've not seen the slide yet.
Yes.
Okay. What about now? Okay. I don't know why it's not showing. But if you can share it from your end, it will be okay. Because I think I'm using my web.
Okay, okay. Maybe you can just.
Yes. Try and see if you can share from your end because it's
Okay, can you
just
just like send me the. Okay, wait, hold on a minute.
yes, yes, it's there with you. Okay. I think it's showing now. Is it?
Yes, yes, it's showing now. It's starting now. Yes, completely. Okay.
Okay, that's beautiful. Sorry for the little time spent. So I always have a quote about upfront. What a leader should do is have a keen eye for geniuses around and be able to distribute these geniuses based on their slices of creativity and create a safe space for them to explore their creativity, thereby driving innovation to organizational goals. So that's one of the major roles of a leader. I am Dr. Oban Nifechidere Sophia, and David has said a lot about me. And I manage distributed research teams every day, every time. So I'm going to have this session based on personal experience. You can call me a story. I'm going to have this session based on my experiences from working with I'm founding Sobanis Resources Limited, which is a premier research hub and also a freelance hub as well, as we have a lot of creatives, a whole lot of researchers, graphic designers, just name it. As far as the creative, you are part of Sobanis family. Endocrine Health Foundation was fully registered last year, but we've been in existence since 2017. And so far so good, working hand in hand to make sure that women facing endocrine health issues, most especially PCOS, are being educated and are being catered for through our collaborations with major healthcare facilities and healthcare practitioners. So we're going to look at a little overview of this session, which is the purpose of this presentation, which is to talk about using AI to have a blended team in quotes, the historical perspective, where we were and where we are right now, the importance of distributed teams, and finally, the role of AI in research collaboration. So let us revisit the evolution of AI in team management. So let's move on this journey. So before the 2000s, organizations were relying mostly on manual project management tools, such as manual Gantt charts. So it was like the typewriting time, and the era of Corel draws, and also the era of physical meetings. Back then, remote meeting was really really scarce, as everyone has to like be in a physical space, have a supervisor working around, ensuring that tasks are being allocated appropriately and carried out within a certain time frame. And then around the 2000s, we began evolution as regards to corporate management. So that's where the advent of digital collaboration platforms were brought out, such as collaboration platforms such as Skype, Zoom, Google Meet, Collab, etc. And then in 2010s, we saw the merging of cloud and automation tools such as the AWS. And within the 2020s to where we are now, we have the LLMS for research, which makes both, it's just like a one in all segment where research, data collection, analysis, it's done at once in a seamless flow and manner. So LLMS for research and workflow intelligence came around the 2020s, and we have examples such as Quex. And then about Endocrine Health Foundation and Subanis Resources Limited. In Endocrine Health Foundation, currently we have about 20 active volunteers, and these volunteers are mostly state team leaders who have the responsibilities and roles to develop their own set of volunteers, community-based volunteers, school-based volunteers, NYC-based volunteers within their allocated states. And then within EHF, we also cater, not just have, because we have what we call a sanitary pad bank. We also have collaborations with certain health institutions where women who goes for routine checks are being checked for a particular discount fee. So in that community, we have about over 300 women suffering from polycystic ovarian syndrome, and they are being, and every year we always have testimonies about improvement of health, having babies and all that. And so the major thing is we focus on endocrine health awareness campaigns, support group, and most importantly research, because one thing about the endocrine health initiative is we carry out awareness raising for endocrine health issues, and most endocrine health issues amongst females are really, really silent, such as the polycystic ovarian syndrome. So research is very important. So there we have on field and we have both on-site and offline data collectors that goes out to collect data concerning the female health, because as at this point we have about 1 in 3 women suffering from polycystic ovarian syndrome. So it's not possible to raise awareness on a syndrome that is kind of silent without carrying out first-hand data collection. So they're fully involved in conducting research. And then for Sobanis Resources Limited, which is my profit organization, we have a multidisciplinary team of over 30 individuals who are very in-depth and adept in research, because it's a core research organization before any other thing else. So these were the pre-2000s challenges of handling a distributed team. It was quite complex back then, as we didn't have these AI tools that have enabled us to have a seamless workflow at this point. So back then, there were communication gaps. In order to communicate with one another, you have to meet in a physical space. So being a community worker, because I started my career working with various INGO in spaces of being a volunteer and then to a staff and then contract staff before I set up my own. So back then, since I was majorly in communities, we were always meeting under a tree, a random tree. So that's where we sit down to make our communications. Then we have these cardboards where we write down our roles and our tasks. Our tasks are located manually. So there was nothing like we are not really using AI back then. So it was all manual. We get to know what we are doing, have a little piece of paper, and where we like, paste our sticky notes around. Early in the morning, we wake up and we know what we have to do the next day. So there was this communication gap whereby if you're not physically present, it was very difficult to pass across information. So we had to meet other challenges are tracking tax application. It's another thing to track the process, the progress of this tax. So it was quite detrimental, and also led to a whole lot of lateness in delivering projects reports. So version control for research documents, also maintaining research quality across contributors. So now, how these challenges is being managed through the implementation of AI in our daily professional processes. So now there is cloud-based collaboration for this communication, in order to solve the communication barrier, and such as Zoom, Google Meet, Teams, Slack, Microsoft 365. Like in here, we are all a set of multidisciplinary
Sorry,
talents,
sorry, Dr.
and
Sophia,
we
please, sorry, just a
are.
bit. Please, can you make the slide to be full screen so that it can be easy for the participant to view?
Oh, okay.
Yes, thank you.
Is it
Just,
better now?
just, no, no, just click the funnel button below. All right, thank
Yeah. Okay. Oh, this is too Zoom. Is it okay? Is this good? Is this okay?
No, drag it back. Drag that thing back. Drag it back. Click
Okay.
on that funnel. There's a trophy after that minus and plus by your left. Just click on it. It
Oh,
will bring.
this, yeah?
There's a small trophy, at that place that you dragged it. There's a small trophy there.
Okay, 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 okay.
No, not that
Oh,
side.
okay.
Not there.
Oh,
I think you can continue. Just
true.
continue that way. You can share it back and continue.
Okay.
Sorry.
Yeah. I'm trying to. So I have to, okay. Sorry for this. Okay. Uh, yes. And the cloud-based collaboration, which I've explained how it has been able to bridge that gap in communication. AI-assisted literature reviews, such as Consensus, Elicit, Research Rabbit, Sites, Zotero, we have Mendeley. And then we have automated reminders to be able to let everything know when it is to evaluate their tasks. So we use things like Google Calendar, Calendly, and the Zoho. Then automated storage system like Dropbox and Google Drive. So what we have achieved so far is enhanced coordination as everyone is working hand in hand. There is a funnel, there's a free flow of tasks being allocated, and there's also a monitoring system put in place to ensure that there's progress in every task allocated, and also there's an evaluation to evaluate how, especially mostly in community-based projects, how these projects have been able to impact the community both positively and negatively, and how we can see what to do well and how to right our wrongs rather. So for Banish Resources and even EHF, the whole research process, could use things like Copilot and ChatGPT for drafting research frameworks, Notion AI for documentation, AI transcription tools for interviews, and AI based analysis assistance. So I'm going to draw from two case studies. So the first one is what we call polycystic ovarian syndrome at
We can't see
work.
your screen. No, we can't see your screen again.
Oh, you can't see my screen.
Yes, yes.
Okay.
Just collapse it and share it again. Okay, we can see it
Yes,
now.
that's what I'm
We
trying
can
to
see it
do.
now.
I see my screen now.
Yes, yes.
Okay. Can you see it?
Yes, we can. We can.
Okay. Okay, so polycystic ovarian syndrome at work is one of our projects that we'll be implementing in 2026. So over the past, we are trying to bring polycystic ovarian syndrome to the forefront of those in the corporate spaces. So over the past 1 year, we have been carrying out surveys to understand the population number for women who has polycystic ovarian syndrome in the workplace, using two key industries as our case studies. So we've been able to use AI to structure workplace survey instruments, organize qualitative responses from employees, automated literature reviews, and also generating corporate awareness materials efficiently. I don't think we would have gone this far if we had been working manually and if we had not been blessed with the this 21st century AI implementation. And then our next case study is the polycystic ovarian community research, which is currently ongoing. In fact, it's been ongoing for the past 4 or 5 years now. So here we carry out AI-assisted survey design for hormonal health. So before this was done, I wish I had pictures to share. So I felt this was done in the marketplaces and mostly school-based, where we carried out, our researchers will carry out, manual questionnaires to go and share around for women to fill up what their symptoms were, their period duration. So now it's quite easy, as we just have to, create a kind of Google Sheets, or sometimes we use SurveyMonkey to share this across amongst females with PCOS, or females who possesses some certain symptoms of PCOS. And most of these questions are, designed to understand the amount of flows, because people with PCOS most times don't even see their period in a year, or they could get at least 6 menstrual flows in 1 year. So these are kind of surveys we carry out to also know their dietary pattern and their lifestyle choices and etc. So we also use AI for data cleaning and preliminary analysis, using AI tools, generating awareness and advocacy content, and also fully for using AI for to manage 300 plus community insights at scale. So the AI for data management, like I've explained before, cleaning data sets, checks, ensuring consistency across multiple contributions, and how have we been able to assess this clean workflow? So by using AI tools such as Notion and ClickUp for a central hub design, assign class owners, integrate AI summarizers and automation, standardize file naming, versioning, weekly AI generated progress summaries. And we cannot do all this without considering the ethics, which includes data privacy and security, trying to avoid AI bias, ensuring proper oversight by human researchers. So which brings me to saying, in as much as we have been able to merge AI into our daily workflows, it does not really account for a full level of leaderships. So leadership is the ability to be able to merge these two, make sure that even though we are consulting AIs for most of our workflow, we also get to keep the human part of it. We also get to keep our team thinking on their feet and not just relying heavily on AI. We also need to make our arguments when AI give certain summaries and conclusions. We also need to make our arguments and see those gaps as well, because over reliant on AI to do all our daily workflows can actually lead to biases in AI and inconsistent conclusions. And then that brings me to a conclusion on both Sobanis resources and EHF. So for Sobanis resources, the distributed team in SRL can work seamlessly with the right AI ecosystem, and EHF demonstrates how AI enhances productivity, research quality, and community engagement. For EHF, we've been able to start working on an MVP product which assist females with irregular monthly flow to be able to track their periods, because I think that's one of the gaps in the feminine health. We have period trackers, but those who do not see their period often can't rely on these period trackers. So that's why we've been heavily reliant on carrying out a lot of research to understand the patterns of these individual women. How often do they see their periods? When and where? What are their dietary choices? And then we've been able to start building something in that environment. So on this junction, I would like to appreciate you all for listening. Thank you very much.
Yeah, thank you very much, Dr. Sophia Ifichidere, for that seasoned explanation on PCOS research and also what you're doing at Sobani Resources. That's a very, very massive presentation. And we want to really say thank you. So if participants, if you've got any questions for her, please just drop it on the chat box. We are going to go over it. And yeah, she'll get to respond to that. So thank you for once more. I'm going to be introducing our next our next speaker, Mr. AK Chijioke, for a more practical session right now. How she's going to illustrate how we can create dashboards with Power BI and also how to manipulate data. So Mr. Chijioke is somebody that I've worked with. In short, I'm going to call him my father. Back when I was in the university, I was just a boy who wanted to have a political future. And the truth is that my political ambition wouldn't have been possible without Mr. Eke Chijioke. Yeah, he's a dedicated data analyst with a passion for leveraging insights to drive business decisions, specialized in transforming complex data sets into actionable intelligence. He has over 5 years experience uh, in data analytics, and he currently improves track record of identifying trends, developing predictive models, optimizing processes to drive organizational growth. Somebody that is a data analyst is part of his job. So one of the part of his job that he loves really so much, according to him, is that he loves building insightful and colorful dashboards and visuals for conveying them to stakeholders or business owners for data-driven decisions. So the truth is that if you're here, you might be somebody that's a business person, you're trying to run any form of enterprise. The truth is that data analysis and analytics is something you cannot overestimate. It's not something you can overlook. And what Mr. Chijioke is going to do right now is going to show you how to practically, transform data into something you can use in informing decision, something you can use to make decisions for your customers, of maybe probably working in health, you work in a healthcare organization or whichever strata or unit where you find yourself to be. He is going to do that particular practicals for us right now. So at his leisure, you can find, if you have any issues or maybe relates to data, he plays chess. He loves playing chess and video games. And yeah, according to him, he loves playing chess and video games, at his leisure. So if you have any insights about data, he's the go-to guy for that. So before we continue, I just want to is there a question from there's a question from Onyemechi Namchi. You're raising your hand, so can you unmute before we bring in our next speaker? So go ahead. I guess you have a strong point question. So Onyemechi, unmute yourself.
Morning, sir. All right. Good
Okay,
morning, sir.
thank you.
Good morning to our presenter, that's Dr. Sophia. My question is on the PCOS that she mentioned. There are so many people around me that are having irregular menstruation. In fact, one person like that, she's a lady, she told me that the whole of this year she just menstruated once. And she has been told that she has PCOS by 3 different doctors and that she will not be able to conceive when she gets married. I also have somebody that is very, very close to me, came to me and was telling me that she was diagnosed of PCOS. And she's a very young girl, just about 21, 22. And I was concerned because I've monitored her period, her menstruation, and she's having a regular period and all that. And I'm a doctor, just a medical officer for now, so I don't really know much details. Like, I've not really delved into much details of the gynecology aspect of health. So, but I want to get more of what Dr. Sophia is doing in PCOS, because I would want these people to get the best of care, and as well as get access to a community where they can get reassurance, and also they can also have a good solution, like a solution for what they are experiencing. So that's my question. Is for Dr. Sophia.
Okay, Dr. Sophia, please, can you just react to just that question? If there's any other question, please, you can drop it at the
Sorry,
chat
can
box.
you come again? Sorry. Can
Okay,
you
I'm
repeat your
saying that.
question?
Yes, I'm saying that there are some people that are experiencing this PCOS. They have been diagnosed of PCOS. I base in Enugu here in southeastern part of Nigeria. So, like yesterday, I got to have I met someone just menstruated once this year, and then someone close to me also has sent me yeah, a report of a diagnosis of PCOS, a young girl of 21, 22. Okay, so I want to know what is going on in your endocrine health campaign. Like, how are these people going to get a lasting solution, or yes, a dependable solution for their conditions? Like, how are they going to get reassurance, or what is it for them? The future for them and all that. So how can they benefit from the work that you are doing?
Okay, so at the moment, we are all aware that there is no cure, but there are treatment options. And one thing the community does is to show you that you're not alone, to tell you that there are other people too who are there trying out so many research and so many things to get better. And there's a major gap we have in the PCOS community, and that is medical practitioners not listening, because PCOS is a metabolic disorder. It affects not just the reproductive health, but mental and every part of a human system. So we kind of look for healthcare practitioners who can listen to these individual symptoms and treat these women based on their individual symptoms. For example, in Lagos, we are collaborated with LUTS, so people from our community can easily go there to the IVF center and have discussions with our contact person there. We also have a collaboration with Abim's Fertility in Lagos as well, where there's subsidized rates for testing and services. So we are trying to spread to other states as well, to collaborate more with healthcare practitioners. But for now, the community is like a safe haven. And you can get my contact from David, and they are welcome to join the community as well. So in that community, they can be able to ask questions and they will get prompt responses to those questions. There's also a meal guide as well, to help track their lifestyle choices. And once in a while, we host exercise challenges that actually makes these women get better. And I always tell people we've been celebrating a lot of babies. I'm talking about babies from women who have been married for 7, 12 years. And it's not because we are giving them any miracle drugs, but it's because of that mental stimulation, knowing that they can easily talk about their symptoms and get prompt responses to that. So it's really helping. So you can get my contact from David.
Thank you very, very much. Thank you so much for that response. So we're going to be bringing in, he's already here already. That show you how active uh, my my boss is. And he's going to be doing giving us a very smooth practical session on Power BI. And yeah, I'm sure it's one that promises to be very insightful. So let us pay rapt attention to the practicals and get started. Thank you very much. Welcome.
Yeah, yeah. Thank you so much, David. David, you brought nostalgic memories from time undergraduate studies. I studied in Futo, and David also did that in public health department, Federal University of Technology, where. So can everyone hear me clearly? I would say it's a privilege to speak at the maiden edition of this Cindra 2025. I was expecting to see one of my lecturer, Professor Chukwacha, but I think he might be unavoidably absent. I don't know. So let's just continue. David has said a lot about me. I had a slide here that wanted to speak about me. Okay. One thing about me is that I'm a seasoned data analyst, and although currently I am studying to become a data scientist, carrying a course in data science diploma with All School Africa, and I'm the lead person at Data Basics Hub. Data Basics Hub is a very new training hub that focuses on capturing young newbies or the newbies in the field of data and training them on the core and basic practical skills they need, especially in tools like Excel, Power BI, SQL, Python, and then sometimes we extend our hands to Google Cloud. Because of my introverted self, I like to play chess and then video games. So I'll be speaking on, can you all see that please, the slides? I'll be speaking on business intelligence, data integration. Wait, can you hear me? Hello?
Yes, we can hear you now. We can hear you now. We can hear you now.
Hello.
Oh, okay. Okay, nobody was hearing me before, right? Oh, okay. So I will be speaking on business intelligence, data integration, and advanced analytics with Power BI and Tableau. And because of the short time we have, we'll be doing a practical session outrightly. I shared the file we'll be using today with Chamaka. Is that Chamaka Eugene, if I'm not mistaken? So she can decide to send it in to the chat group here for people to download straight if you have your PCs on, and then practicalize with me as we do that, okay? So now we'll move forward. Now, this is going to be what we're going to be looking at. We're going to be talking about brief history of Power BI. Do not actually know how they came about, how they evolved, what brought them. Okay, we're going to be touching that, and then we'll be talking about the capabilities of these both tools. The two of them are data visualization tools. We have data analytics tools, we have data wrangling tools, and now we have data visualization tools. Data wrangling, when you manipulate the data wrangling tools like the R, SQL, Python, you use it to manipulate your data, especially when you're dealing with complex tools, is mainly just like Power BI, Tableau, uh, uh, Zoho, Looker, and Co.